Okay, so we're going to have a third part presented today, scientific data, the excipient aluminum adjuvants, and that's the topic we'll delve into today. First study we're going to look at here is aluminum neurotoxicity in preterm infants receiving intravenous feeding solutions, published in 1997 in the New England Journal of Medicine. They looked at preterm infants in the neonatal ICU, born less than 34 weeks of age. They looked at 227 neonatal uh, um, neonates, infants, and they broke these babies up into two different categories. One, they all required TPN, which stands for total parenteral nutrition. They couldn't use their gut because their guts were too immature to take the feed, so they were given IV nutrition called TPN. The first group got the standard amount, which is 45 micrograms per kilogram per day of the aluminum in that TPN. And the test group got a lower amount. It was a special formulation. They had a lower amount of aluminum, which was 1/10 the amount, which is 4 to 5 micrograms per kilogram per day. Why aluminum's in the TPN is beyond me. I have no idea why they would put a known human toxin in a feeding solution for little newborn babies, even premature, which were more susceptible to the toxicities, especially aluminum. Because aluminum is not a preservative. I'm not sure why they add aluminum to it, but in any case, aluminum is part of a standard TPN at 45 micrograms per kilogram per day at that time. In any case, what they did is they looked at these infants that they got this TPN for a 10-day period of time, and they checked these babies at 18 months, which is much later when they about a year and a half later. They did this uh, uh, cognitive test, a mental development test called the Bailey Mental Development. And they made an index. They tested these babies and came up with this scoring system. Normal score is 100. Well, overall, the babies who received the standard TPN got overall a lower score by 10 points, and that's statistically significant. Um, and the In addition, the babies who received the standard TPN, which is the higher aluminum dose, also were twice as likely to have a score below 85 points, 35% versus 17%, also statistically significant. Um, and the investigators and the attendings were all blinded, so nobody knew which baby was getting which solution. And the authors point out in this article that the mental development index at 18 months has been shown to be an early predictor of IQ later on in life, as well as neurodevelopmental delay increases the risk of educational problems in later years. The next study is published in 2009, and this study called Toward an Understanding of the Adjuvant Action of Aluminum. What this study did is it basically just looked at all the studies that were published from the beginning of this whole process of putting aluminum in vaccines up until the time it was published, which was 2009. And it was a review of all the history about and the timeline of all the papers published. Aluminum is put in vaccine as an adjuvant, and add that what that means is that, and we'll see in this paper, an adjuvant theoretically means that it makes the vaccine more immunogenic. It does its job better theoretically to create more of an immune response. That's the whole goal behind it. And and what initially started um, concept was the history of when aluminum in the early 1900s hundreds when they were making vaccines. This is the timeline in 1926. It was discovered that aluminum precipitation enhances antibody response to diphtheria toxoid in guinea pigs. So in other words, the antigen, which is the vaccine, the part that actually of the injection that is the vaccine, you attach that to a aluminum salt, aluminum potassium sulfate in that case, it got a better response, which means that the response of the antibodies was more longer lasting in this group of guinea pigs. And then and it was then this researcher Alexander Glenny found in 1932, which is it was first shown that alum, which is the aluminum formulation back then that they used, enhanced diphtheria toxoid in immunizations in humans. In other words, he found the same thing in humans. And let's go through all the different uh, papers that were written or presented, and there really wasn't that many from 1910 to 2008 on this topic. Um, and the aluminum formulation called alum, which is aluminum potassium sulfate. This is the one that was used way back when. The current ones that have been put in vaccines today is mostly aluminum hydroxide and aluminum phosphate. There's another formulation as well, occasionally used. But so this Alexander Glenny researcher, he believed that aluminum salts were effective adjuvants because they allowed the antigen to remain in the body for a long period of time, and because the antigen was slowly released from the insoluble salt particles. In other words, aluminum doesn't metabolize so quickly; it stays around in the body a long time. So when you attach it to the vaccine, the theory is it's going to get a better immune response. And this allowed prolonged and effective stimulation of the immune system. And the effect is called the depot effect. So for approximately 60 years, this explanation was dogmatically accepted within the field, and only a few basic research papers on aluminum salts were published, often decades apart. Um, and this article cites many studies, not as many you would expect, but looked at all the studies published until 2009. But basically really didn't the data that's looked at over time didn't really show that this concept of having the the aluminum added to the vaccine given it doesn't really cause a better um, efficacy of the vaccine in the end. Even this concept, this depot effect, there were two studies in 1950 and 1955 that showed the opposite. It didn't prolong it at all. But the idea that you want to increase the antibody levels sounds good, but first of all, if the antibody levels are too high, that can be counterproductive. It's something called antibody-dependent enhancement, um, as well as the fact that is it really going to help the correct antibodies that you would need versus having other antibodies that are not neutralizing. The other issue is that the negative effects of aluminum, even if it's true that aluminum will prolong the antibody response in all cases, um, even if that were true, the negative effect of aluminum is that going to outweigh the benefits of having more antibody response, even if the antibody response was good? So um, the authors, after looking at all the research during this time, um, stated the following in a category near the end of the article called Outstanding Questions. And they state recent studies have increased our knowledge of the biological events that are induced following the administration of aluminum adjuvants. However, the mechanisms that are required for the subsequent induction of the adaptive immune response, antibody response, are still debated. Some additional questions remain to be answered, and some important discrepancies need to be resolved. And they'll go on to say also, finally, after over 80 years of research, there's still no definitive proof for Alexander Glenny's original hypothesis that the depot effect of aluminum salts contributes to their adjuvant action. So really, up until 2009, this whole concept of adjuvants is pretty sketchy, actually, based on a 1932 study on humans. Um, the next article I want to present to you, published in 2011, called Do aluminum vaccine adjuvants contribute to the rising prevalence of autism? By Tomljanovic and Shaw. And they state that nothing's known about the toxicology and pharmacokinetics of aluminum in infants and children. I sort of put in there, I crossed off little just to show you would think that at least something's known, but the authors state, that there's really nothing known in infants and children up until 2011. So this article looks at the ranges of aluminum content in vaccine schedules in the Western countries in correlation with the relevant autism spectrum disorder prevalence. The data is from two different sources. One is the U.S. Department of Education annual reports to Congress from 1991 to 2008. They looked at the incidence of autism spectrum disorder in 6 to 21-year-olds, and they correlated that with the vaccines given from birth until the age of 6 years old, that which was sourced from the CDC data. They also looked at the 6 other governments, Western countries, UK, Australia, Canada, Sweden, Finland, and Iceland to compare. Before the authors go into the data that they present, they point out the following. They put this table in the article showing us that these are different various diseases in adults that have been linked to either straight up aluminum or aluminum in vaccines. So these arrows here, which are pointing to arthritis, multiple sclerosis, chronic fatigue syndrome, Gulf War syndrome. These are called autoimmune inflammatory syndrome induced by adjuvants, ASIA. That's what they're called. So these have been shown to result from vaccine adjuvants. And ASIA that has been shown to be caused by these vaccine adjuvants in adults needs to be really thought about pretty seriously, because if you think about it in kids, like how do we compare this with kids? Well, first of all, we will see in a few more studies that we're going to show today that the milligrams per kilogram or micrograms per kilogram, in other words, the dosages, the relative dosage based on by body weight, is much higher in kids and in babies than it is in adults. So the babies are getting a much higher dose for their size. That's one. The second thing is this: is that the pediatric patients have developing brains, and aluminum is a neurotoxin. Neurotoxins can cause toxicity to brains, and if brains developing, they're more susceptible to the toxicities. So it's much more damaging to a baby and to a child to get a neurotoxin than an adult who's already having a developed brain. The other issue is that the blood-brain barrier is less developed in a baby. The younger the baby, the less developed it is. So if they get this aluminum, it's going to go right through this blood-brain barrier and cause neurotoxicity. So the other in addition to the ones, these arrows being pointed, which are considered to be Asia, these conditions called Asia. In addition, the other ones, all of them that are listed, they all have an asterisk, and these have all been linked to aluminum adjuvant vaccines as well. So they may not be considered Asia, but they were considered linked to aluminum adjuvants and vaccines. For example, arthritis, diabetes, multiple sclerosis, lupus, chronic fatigue syndrome, Gulf War syndrome, autism spectrum disorder. In addition, there's a couple other they threw in here, some other inflammatory problems. And what's common to a lot of these is the inflammatory profile of these diseases match very much to the inflammatory profile of aluminum adjuvants in general. When you look at what it does microscopically. So, in other words, there's a significant biologic plausibility here. So this is what's going on in adults. Now let's look at the children. This is the data that they show. This is the data from the U.S. data where they compared the aluminum exposure up until the age of 6 years old with the autism spectrum disorder from 6 to 21 years of age. And they looked at those with minimal exposures and those with maximum exposures, and they took an average as well. And they found, in other words, how many milligrams are these kids being exposed to. So the more milligrams are being exposed, the more cases of autism spectrum disorder. So they found no matter how you look at the data here, it's a dose response relationship. So this is based on micrograms of aluminum exposure, and this right here is the this um, the table that really describes the same data. This is the same data set. They had an R value in the Pearson R here, which is really the relationship, as well as a relationship was of one would be sort of a perfect one-to-one relationship. But the main thing to look at here is the p-value. P-values are very, very low. That means if this data was obtained by chance alone, the likelihood of that is less than 0.01%. So that means we accept this data as true. So this is going by microgram exposure total. This next table looks at number of vaccines. Rather than look at micrograms, it looks at just number of vaccines. This is statistical analysis summary, correlates the number of children with autism spectrum disorder from 6 to 21 years of age. This is the US data again, with the number of aluminum adjuvant vaccines in the yearly schedule from the time up until the time they turn 6, from 1991 to 2008. And so they found also a p-value of less than 0.0001, which is less than 0.01%, which means that even if you look at it by number of vaccines, there's still a correlation with the aluminum-containing vaccines with autism spectrum disorder. So now we have micrograms, now number of vaccines, and the third category here that they looked at. This is how the other Western countries came in. They compared these different countries with when the vaccines are introduced in life. In other words, if they're introduced earlier in life, there's more of an effect. So here they didn't look at milligrams per se. I mean, you can add up the milligrams total, but I'm saying what they're really pointing out here in this table is that the UK, for example, gave vaccine at birth, 1 month, and 2 months, and they had the highest autism spectrum prevalence per 10,000 people, which is 157 per 10,000 at this time. The US, Canada, and Australia, they'll give it at birth and at 2 months, and they also had, the sort of the second category in terms of prevalence. And then the Sweden, Iceland, and Finland, they didn't give any vaccines until 3 months, and their autism spectrum disorder, although high, is still lower than the ones who introduced it earlier in life. So there's three ways of looking at when you're giving vaccines, whether you go by the microgram dosage, whether you go by the number of vaccines given total, or whether you go by how early it's introduced in life, and they're all associated with autism spectrum disorder. What this table shows in the same article is comparing it to the adults, like we said before. An adult receiving a hepatitis B vaccine gets 7.1 micrograms per kilogram of body weight. Okay. An infant receiving a hepatitis B vaccine, which in the United States now they get on the first day of life, which is beyond me. Nobody knows why. The only explanation I've heard from pediatricians is to get the parents used to giving vaccines. There's no other reason, because hepatitis B is contracted by sexual transmission, IV drug abuse, blood transfusions. And we know that these are not really issues in a 1-day-old baby, and the vertical transmission rate for hepatitis B, in other words, the mother having it, passing it on to the baby, is fairly low, although giving the baby a vaccine, if that has happened during the birth process, is not going to help the baby. So the vaccine is completely irrational, other than just merely sort of, I guess, mind control is the only real reason they give it to babies. But the bottom line is, if we compare the dosage by body weight, here you have 10 times the amount in in an infant, 73.5 micrograms per kilogram versus 7.1 in an adult dose of hepatitis B. And the infants are more susceptible because their blood-brain barrier is less developed. They have more developing brains. And as we see here, there's higher dosage. 2 month, they can receive up to 172.5 microgram per kilogram body weight. That's a lot. Okay, now this article also sort of, towards the end of it, mentions this Bradford Hill criteria, which we talked about in the first section of the vaccine talk. And we looked at an article where these experts published this article on this concept of Bradfield Hill criteria, and we learned that the authors there in that article show in the article that with very good rationale that all you need is 4 out of 9 to show causation. And here you have in this article we see that there's 8 out of 9 that are present. I'll just go through them real quick. We don't go through the details of the article because we don't have time, but they were able to show biologic plausibility, strength of association, consistency, temporal relationship, coherence, experimental evidence, dose response, and analogy. So the authors in this article clearly, unequivocally are showing us that there's causation here. In other words, aluminum is causing autism spectrum disorder. Next article published in 2018 called Aluminum in Brain Tissue and Autism. This is a pathology a study that was published, and they basically did they did an autopsy on 5 patients with autism spectrum disorder. The range of these 5 individuals between 5 and 50 years of age, and of course after they died. And then what they found is 5 out of 5 of these patients had very high aluminum levels. So the norm, I'll show you in the bottom of the slide here, it says control comparison, which the control is, in other words, an insignificant or baseline aluminum in brains is considered to be less than 1 microgram per gram of dry weight. That's the standard normal dose you'd find in somebody who doesn't have any aluminum burden. So, and so here they found all 5 brains. They had very high levels. One was over 4 micrograms per gram of dry weight. 4 brains had over 5. Now, of those 4 that have over 5 micrograms per gram of dry weight, okay, 3 out of those had the highest in recorded history in terms of any published data. One had 17 micrograms per gram, one had 18.6, and one had 22.1 micrograms per gram of dry weight, suggesting that the autism spectrum disorder diagnosis in these individuals is associated with high aluminum levels. Where do they find the aluminum? They find it in all parts of the brain. If you want to look microscopically, the white matter, the gray matter, the extracellular space, the intracellular space, the meninges, the vasculature, the glia, the microglia, and the inflammatory cells all had aluminum, significant aluminum. They looked at, if you go by lobes, the occipital lobe, frontal lobe, temporal lobe, parietal lobe, all had aluminum. It goes everywhere in the brain. This next article, also published in 2021, called Reviewing the Association Between Aluminum Adjuvants and the Vaccines and Autism Spectrum Disorder, published in the Journal of Trace Elements in Medicine and Biology. This author, Albert Beretti, looked at all different ways that you can sort of show this common question, I guess, to answer this question. Aluminum adjuvants is an explanation for autism spectrum disorder. Do all these different types of articles add up to this real conclusion, I guess, to answer the question and conclude that of whether or not it does or not. They looked at ecological studies, animal models, measurements of aluminum concentrations in patients with autism spectrum disorder, and they looked at various mechanisms and put all the information together in this published article. And what they found, just to summarize their findings, is that they looked at all these different. It was basically a review of many different articles. What they found, there was a parallel rise in aluminum adjuvants in the vaccines for infants and as well as for infants and autism spectrum disorder. There's a correlation there. Injected aluminum induces behavioral changes in mice. And by the way, when you inject aluminum in mice and you see an acute change in their behavior, that's shows you this it's a neurotoxin. However, there may be effects to the mice that you can't detect acutely. In other words, there may be long-term effects of the brain. You don't know, which it's important to remember because of another point I'm going to make regarding mice. Brain tissue donors from patients with autism spectrum disorder contain more aluminum than controls. Numerous mechanisms exist that can explain aluminum neurotoxic effects. Other findings, countries who have had higher vaccination rates have higher rates of autism spectrum disorder. Safe aluminum dosing is inadequate and based on theoretical dietary titration studies in mice. And this is what I was talking about. Just because the safe dosing is based on the dietary titration in mice, they look to see the behavior change. Um, that is that that's not a very good way to measure what's safe in humans. Um, um, so in any case, aluminum as an adjuvant in vaccine is unproven, like we sort of looked at, because this article was published in 2011. So they added the data from 2009 until 2021, in addition to the data that was shown in that article that I showed you, the second article we looked at. Other findings, the pharmacokinetics of injected aluminum adjuvants are inadequate. In other words, the depot theory, these guys also comment on that, and they added more studies since 2009. It's really not a proven effect at all. Um, when mercury, thimerosal, was removed from or really decreased, it's a long story whether it was really decreased or removed, but ostensibly it was removed in the 1990s. So when mercury was removed from vaccines, except for the flu vaccine, by the way, that was exempt for another reason we won't discuss here. But most of the vaccines, except for flu, it was extensively removed in the 1990s, and then what happened there when the mercury was decreased, they increased the aluminum. So, and it's nonsensical because these two are not related in any way, because mercury or thimerosal is used as a preservative and aluminum is not used as a preservative at all. It's used as an adjuvant, like we talked about. Aluminum it's been implicated as a cause in multiple sclerosis, epilepsy, cerebral amyloid angiopathy, dementia, cerebral palsy, and chronic fatigue syndrome. Their conclusion, the consilience of evidence supports that aluminum adjuvant as an etiologic factor in autism spectrum disorder. That's what they concluded. This article from 2023 was published in the Journal of Academic Pediatrics. Was an observational study using the data from Vaccine Safety Data Link retrospective cohort study. They looked at 326,000 children. They looked at its association with asthma, right? So this was the reason why this study was performed. It was because the Institute of Medicine 2013 made a recommendation that the vaccine schedule should be studied for safety. And this is one of those articles that was published in response to that. And ultimately, that decree by the Institute of Medicine 2013 was to address some of the issues that were concerning many parents who were there was a sort of a grassroots concern by parents around the country, um, concerned that their kids um, 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 acquired autism from the vaccines. That was the concern. So this study did just that. And the cumulative aluminum exposure in vaccines by age 24 months correlates with the diagnosis of asthma at age 2 to 5 years of age. This is what they ultimately found, and they controlled for other confounders like, say, gender, race, eczema, prematurity, medical complexity, healthcare utilization. And here's the main um, um, graph in the article, and they looked at those with eczema and those without eczema. And what they found is um, the number of vaccines. I'm sorry, this is not number of vaccines. This is the milligrams of aluminum estimated in the vaccines. So the more vaccines, the more milligrams. So they sort of calculated the amount of milligrams that these kids were exposed to. And what they found is there was a relationship between the increase in milligrams of aluminum and the in asthma in the population. And here the statistical analysis over here from that data. They calculated hazard ratios, which was really very similar to an odds ratio. So it was in a dose response fashion, which strongly suggests causation. The p-value is less than 0.05, so it's statistically significant. They found that the 26% risk increases with per milligram of aluminum with those patients with eczema, and there's a 19% increased risk per milligram of aluminum in those without eczema. If they looked at the higher exposures of aluminum, greater than 3 milligrams as compared to less than 3 milligrams. They found it's even stronger association with asthma. They found a 61% increase of asthma with those with eczema and a 36% increased risk of asthma in the higher aluminum exposure in those patients without eczema. Okay, this is um, a publication that's intended to provide education for physicians. It was updated in 2024, and this particular physician for informed consent piece was on aluminum and vaccines. And what they did is they showed you at the time this was published all the vaccines that have aluminum: hepatitis B, diphtheria, tetanus, pertussis, the Tdap, the DTaP, and the Tdap, Haemophilus influenza, which is PDVax, Hib, um, pneumococcal, hepatitis A, human papillomavirus, which we're going to talk about that at the very end, and pneumococcal vaccine. So and up to the age of 18 years old, you have this graphic shows that you get up to 22 doses of aluminum-containing vaccines by the age of 18 years old. And the majority of them early in life, as we talked about, which is somewhat problematic. They point out the following, there is aluminum in food. You find it in food, sometimes in the ingredients, but you have to, if you compare the food, which is not good either, and there's no really good rationale for putting it in food. There may be some stability issue. I don't know. I'm not sure what a food engineer would decide, why they would decide to put aluminum in food, but um, my opinion, it doesn't belong there. In any case, you need 1,000 micrograms, 1,000 to 1 ratio of ingesting it to equal the amount of injecting it. In other words, the oral limit is considered to be 1,000 micrograms per kilogram per day of oral ingestion. The blood limit is 1 microgram per kilogram per day. So in other words, you'll get equal amount in the bloodstream if you take 1,000 milligrams orally compared to micrograms rather, compared to 1 microgram injected. So when you inject it, you get a much higher amount. In other words, if you injected 1,000 micrograms, if you inject 1,000, you'd get 1,000,000 because you just basically multiply by 1,000. So for there was the oral equivalent, you'd have to take 1,000,000 micrograms orally to get the same amount as 1,000 micrograms intramuscularly. That makes sense. The U.S. Department of Health and Human Services recognizes aluminum as a neurotoxin. In addition, the FDA has warned about the risks of aluminum toxicity in infants and children. This is from the Federal Register. Okay. And it states the following: term infants with normal renal function may also be at risk because of their rapidly growing and immature brain and skeleton and immature blood-brain barrier. Until they are 1 to 2 years old, infants have a lower glomerular filtration rates than adults, which means they have a lower ability to clear anything like, say, aluminum in their kidney, because that's GFR, is the glomerular filtration rate, is a measure of the kidney function. So infants have a lower GFR, a lower ability to clear things, which affects their kidney function. Yeah. So the agency is concerned that young children and children with immature renal function are not that they are at higher risk resulting from any exposure to aluminum. And this was published by the FDA in June 2003. And as we saw earlier, the relative amounts in the pediatric population is much higher than adults, even though they're more susceptible. So I didn't even mention this point here about the kidney function. Now, how much is considered a toxic amount? Well, the Federal Register states the following, that in the federal government set the amount of aluminum in vaccines to 850 micrograms per dose. This was in 1968. They set this amount, and it still holds today. So that's why the highest amount of aluminum per dose of a vaccine is 850 micrograms, because of this 1968 federal limit, that was put into the Federal Register. What happens to be another federal agency called um, the ATSDR, which is the Agency for Toxic Substances and Disease Registry, sets different limits. They say for a newborn, and this is more appropriate, at least it's age appropriate, 3.3 micrograms per day is the limit. And they even up to 12 months, you get 9.3 micrograms per day. So think about, say, even if you get the lowest amount, 125 micrograms, that's still way higher than, say, if you're a newborn, you get that. That's way higher than the ATSDR says is safe in a 12-month-old. Um, and here's an example of the dosages of aluminum per vaccine. The Prevnar gets 125. That's the lowest micrograms. And this is the Haemophilus influenza, 225 micrograms. The Hep B has 250 micrograms. These different DTaP and DTaP IPV, along with there's another one, the Pentacell. These have 330 micrograms. This Kindrix one has 600 micrograms. This Infanrix DTaP has 625 micrograms. This Pediarix one that has the DTaP, Hep B, and IPV has 850 micrograms. And let's just say you have to have a catch up. You have to catch up, right? Sometimes you got to catch up, and they give you a number of these. Look at all the aluminum you're injecting into your baby. Um, so if somebody has the administration of one dose of Prevnar 13, Pedivax Hib, Engerix B, and Infantrix at one visit delivers 1,225 micrograms of aluminum. Um, so, yeah, it's a lot. Now, this article that was published, I found this paragraph. I thought it was fascinating, and I looked into it. I'll read what they state, and this is regarding the one I mentioned at the beginning here, the one for human papillomavirus. This one here. This is what they're referring to. Okay. Clinical trials, including subjects aged 9 or older, where 13,000 subjects were injected with aluminum compound and 594 were injected with saline placebo, observed 18 serious systemic adverse reactions and in the aluminum group and none in the saline group. So they're looking at the placebo is the aluminum compound and the placebo. Those two were well, actually, let's put it this way. In the study, those were the placebo, both of them. And they conclude safety studies comparing children younger than age 9 vaccinated with aluminum-containing vaccines to young children not vaccinated with such vaccines have not been conducted. So, in other words, um, they haven't looked at aluminum versus no aluminum below the age of 9. But this is where they found this information. This information is in the package insert for this vaccine called Gardasil, right, against the human papillomavirus. And I can tell every parent is pressured by the pediatric office to get their daughter and the son injected with this vaccine. And the only safety study is the one done by the drug company. There are no published studies in the literature that looked at the safety of this vaccine, Gardasil. And I found it fascinating the way they described the way, first of all, it was buried in page 7 in a serious adverse reaction, and is considered to be one that was serious enough to be admitted to the hospital, which is pretty serious. And what they found, just look at the way, I'm just going to read the paragraph and then I'm going to explain it. Across clinical studies, 258 individuals out of 29,000, um, okay? In other words, when they said 258, Gardasil is 128 and the placebo is 130. Okay, seems like equal, right? Gardasil versus placebo, 128 versus 130. And there in the so in other words, they to calculate the number of adverse events of this 258, 0.8% is in the Gardasil and 1% is in the placebo. Seems equal, right? Out of the 229,000 people in the study. Now, the Gardasil number of Gardasil um, was 15,000, okay, overall in the study. In other words, these numbers appear with the adverse reactions, but total number in the Gardasil category is 15,000. So it's 128 over 15,000. And then the AAHS control is 13,000, while the saline placebo is 590 foot. Hold on a second here. These are two controls. The AAHS and the saline placebo. Those are both considered to be the control, right? So the individuals 9 through 45 years of age, men and girls and women, and 9 through 26, boys and men, reported serious systemic reaction. So, in other words, they're looking, what is the AAHS? It stands for amorphous aluminum hydroxyphosphate sulfate. That means that the control here was the aluminum. Now, in the 594, they don't even report here in this paragraph that none of them had any serious effects at all. Instead, they deceive you by telling you that the control, placebo's control, right, had 1%, the Gardasil had 0.8%. Well, the placebo is this, the aluminum. So it's Gardasil with aluminum against placebo with aluminum is both equal percentage, statistically equal. Okay, 0.8 to 1%. They don't even mention that the 594 saline, which is a drop in the bucket compared to 13,000, had no reaction at all. That's the only study that you can find in Gardasil. And that's the end of this talk, and I'll see you and on the fourth and final one, hopefully soon.